Good afternoon, everybody. Welcome to NCVO's webinar on how to involve and safeguard volunteers during coronavirus. My name is Claire Ahrens and I'm the training manager here at NCVO. We're also joined today by Jarina Chowdhury, the volunteering development consultant, and we have Rob on the digital side of things. So thanks very much for taking your time this afternoon to join us. A couple of housekeeping questions. Jarina is going to be presenting to you for about 45 minutes, and then we're going to have a chance to ask questions in the question box at the end for about 15 minutes. So with your questions, please put them into the box. It's an orange box with an arrow if it's hidden. Put those questions into the box. We'll answer them at the end of this webinar. We have got a full house today, so we will not be able to answer all of your questions, but we will do our best to answer as many of them as possible. This is being recorded, and afterwards the recording will be sent out to you. It's also on NCVO's YouTube channel, so if you think it's useful for others, you will be able to forward the link. You're also going to be sent an evaluation form. We'd really like to hear from you what other training you would like, what other webinars would be of interest, and that will be really useful information for us. So thank you very much. Sit back and over to Jarina.
Thank you very much, Claire. Hello and a very warm welcome to all of you joining us for today's webinar. My name is Jarina Chowdhury, as Claire said. I joined NCVO in 2015. And my role is to help organisations learn and share good practice in volunteering. So the format, as Claire said, is about 45 minutes of presentation. So please make sure you're feeling comfortable and without distractions. I'll be running some polls to ask you about your experience and to get you to reflect on the material I'll be showing you. So before we go into the actual content of the webinar, I'd like to give you a brief word on our history. NCVO was founded in 1919 thanks to a legacy of £1,000 from a man called Edward Vivian Burchell. This is Edward, and this quote is from a letter in the Imperial War Museum, London. So we opened our doors, called the National Council of Social Services, in 1919, and in the 1980s, we rebranded to call ourselves the National Council for Voluntary Organisations. You may know us as NCVO. This is our 101st year. So we're an independent charity. We're not part of any regulatory body or government. We're independent from government. We support and represent voluntary and volunteer involving organisations based in England, regardless of where they work in the world. And also thanks to our members, we're the largest membership body for civil society in England. We're very proud of our members. And among our members are trade unions, housing associations, residents, tenants associations, community groups, charities, provident societies, faith-based organisations, NGOs, the list goes on and on, LGBTQI groups. I hope you now have a picture of who we are and our impressively diverse membership. So saying that, then please note that the guidance in this webinar covers England and Wales only. If you're based in Scotland or Northern Ireland, please approach your national volunteering body there if you can't get the information you need from this webinar. Volunteer Scotland covers Scotland, Volunteer Now covers Northern Ireland, and WCVA covers Wales. So this is what we're going to be covering today. We're going to be discussing safeguarding and volunteer well-being. Specifically, we'll be looking at the safeguarding measures you need to take when supporting volunteers to respond to coronavirus. So we're going to look at some common volunteering roles, and we're also going to cover tips for volunteer well-being. I will do my best to answer as many of your questions as possible. Given there are a large number of you today, I'm sure at times I'll be stumped by your questions, so I may not be able to answer every single question, but if you provide your name and email address, and I think that does go into the question box, I will find the answer for you and I will try to come back to you by next week. So by the end of the webinar, we will have explored good practice in safeguarding and volunteering, and we will have looked at wellbeing tips on how to manage your volunteers. So this is how the session breaks down sort of into two parts, how we're going to meet those aims. We're going to spend most of our time, about 30 minutes, talking about safeguarding, and then we're going to have about 10 to 15 minutes on wellbeing. And then it's over to you for questions. So feel free to share any insights in the question box into safeguarding and wellbeing. It's always great to hear what other organisations are doing. And that will take us up to 3 o'clock when we will end the webinar. So I need to also flag to you that NCVO doesn't provide legal advice. We are not trained in the law, and we're not legal experts. Saying that, we do sense check our guidance with regulatory bodies. For example, our DBS guidance has been reviewed by DBS. So before we, right, okay, let's go to the next slide. So let's find out about you. Let's just take a minute to find out about yourselves. And we're going to do a quick poll. Every time you see a slide with a brain in the top corner, you'll know a poll is coming. So please choose one response and tell us what brought you here today. You should be able to see a poll coming up there. I think the poll is being organised by my colleague. Obviously, we're all doing this remotely from different locations, so I am waiting. Great, so while I'm waiting for my colleagues to collate the poll results, I believe that went well. I can just tell you, while we planned this webinar, we had in mind planning this webinar for small community groups. For example, we know that there are lots of COVID mutual aid groups that have rapidly sprung up, and we wanted to offer them some particular support because they're more of an informal outfit and they've coalesced into a really impressive network. But we realise, you know, with our experience of supporting the voluntary sector, knowledge and capacity will vary from one group to the next. Right, okay, so we have a very impressive, I'm just looking at the poll results here. Okay, so 1% have a grasp, 39%, 1% not understanding, 39% have a good grasp, and then 60% of you are experienced. Oh, brilliant. Okay, so that means that I can draw upon you when I expect you to be able to answer everything to perfection. Right, okay, thank you for taking the time to do that. We're now going to move to the next slide. Right. So just to remind you then, we're concerned specifically with coronavirus in this webinar. We're not talking about safeguarding more broadly. There's plenty of information on the NCVO website if you do want to know about broader safeguarding. So let's use the time today to talk about coronavirus. We've reviewed government advice, also the advice that was issued on Monday this week, and our understanding is that people can leave their homes to provide help to vulnerable people and also to volunteer if volunteering cannot be done from home. So whether that's related to coronavirus or not, people can leave their home to volunteer. So just making sure that you understand that so that you can explain to volunteers that that is a perfectly acceptable reason to leave the home. So we're also going to look at minimising risk, and we're going to talk about the DBS. You can't talk about safeguarding without discussing the disclosure and barring checks. And we're going to look at regulated activity, non-regulated activity, and also common volunteer roles. So regarding what everybody needs to know, so some basics then for everyone. Safeguarding responsibilities. Everyone needs to have an understanding, a basic understanding of safeguarding rules. Now, the laws haven't changed because of coronavirus. So that means we all have responsibility anyway, regardless of the law, to make sure that we're looking after the people we're helping, as well as looking after our volunteers. So whether your volunteers are helping through a charity or a social enterprise or any kind of community group or network, regardless of type, everybody needs to be aware of safeguarding. So what this means then is having an understanding of the risks of types of volunteer roles or activities and how those risks will be managed and how to deal with safeguarding concerns. Now, you need to really drill down. When you think about a volunteering role, you really need to put it in situ, and you need to think about what will that person actually be doing. If you were to visually play out in your mind, what would that person be doing, as well as what sorts of places will they be in, and who will they be doing this with, who will they be supporting. So none of this is in the abstract. It's very much about drilling down. Of course, you also need to know what to do if somebody raises a safeguarding allegation. And there's lots of information. These are all hyperlinked, embedded links here. There's a lot of detail on our website for you to explore that further. It's also helpful to think about safeguarding in terms of age, illness, or disability. Now, I'm going to come back to that a bit later, but I just want you to hold that in your head for the moment. Okay, so when we talk about safeguarding, what we're trying to do is identify risk and minimize risk. So here are some things that we came up with, which are also on our website, having looked at the government guidance, that you can do to minimize risk. So follow the latest government guidance, do take time to read it, and try to follow the most recent guidance as soon as it's released. With volunteers, it's a good idea to identify, to verify their identity. You could do that with a driving license or other reliable ID. You know, if somebody's coming to you and they say that they want to volunteer, you should really verify their identification. If a role does require a DBS check, for example, if it involves supporting somebody who is classed as a vulnerable person, then ask a potential volunteer if they have been barred, if they've been prevented from any activity with children or adults. That is a perfectly legitimate safeguarding question to ask. It's quite a critical question, so we suggest that you ask it. It's about how you ask as well, but it's an important one. And when we say volunteer in pairs, if possible, remember to maintain physical distancing rules, but you could also ask volunteers to partner up so that one knows what the other one is doing on their volunteering days and that they check in with one another. So that's about making sure that your volunteers are supporting each other where you can make those arrangements. Recognising that volunteers can help with essential everyday tasks like buying food is great. That's really useful. But if there is a bigger problem, it may be for you to escalate this to statutory services in order for them to address those issues. So I think trying not to be the be-all and end-all, you know, there are other agencies around that have the authority and the remit to step in, and you need to be able to recognise when you're kind of outside the scope of what you can actually do for somebody. Volunteers, don't put volunteers in any position where allegations may be made of them or misunderstandings might arise where they could be avoided. So making sure you have processes that don't leave your volunteers open to misunderstanding or mistrust will also help to safeguard them. So for example, I think everybody knows this, if you're dropping things off for somebody, don't go into their houses unless it's absolutely necessary and you have to have a good reason as to why it's necessary. It's a good idea to encourage your volunteers to just kind of stay outside. Erasing personal data once you have it, remember to do that. If there's no reason to keep it, don't hold on to it. And then also, there's a section on our website on recognising and reporting harm. There's a whole section on this. Unfortunately, it doesn't make for very pleasant reading, but it is very useful for you to kind of get your head around it. So this brings us to disclosure and barring service. So I just want to briefly explain so we all understand that the purpose of the DBS is there to help employers make safer recruitment choices. And how they do that is they check an individual's criminal record history. They check if a person has a criminal record history, and if they do, the different levels of check can reveal different types of detail as to that particular history. So the DBS I'm referring to here covers England, Wales, Channel Islands, and the Isle of Man. So it doesn't cover anything outside of that. So to summarise, there are 4 types of DBS check, and here they are in front of you. They have different legal restrictions, meaning they allow access to certain types of information, as I mentioned, some with greater detail, such as cautions, reprimands, convictions, and others, basic and standard, will have less detail. It's about thinking about the level of check that you need. Enhanced and barred list together is the highest level of check. There is actually no eligibility in terms of checking a role for a basic check. Anyone can get a basic check, but think about time and cost, you know, an effort that you want to put into that process. I should say as well, having a DBS check is only one safeguarding measure of many. That's why it's best to think about safeguarding in terms of recruitment of volunteers, having a safeguarding policy, you know, everybody understanding what that policy says. What are the steps in that? What do people need to do? Many of you will have a designated safeguarding officer. Some of your trustees will also take on a role of safeguarding at trustee level, making sure that volunteers have induction, training and support, regular review of how safeguarding is being implemented as well, involving them in that. So you can see, put together, all of that makes for a much more watertight approach than simply relying on DBS checks. And what I suggest you do is, you know, think about where your gaps are and what you can do about those gaps. Okay, so ever since the lockdown began, we've been talking to our volunteer centre members and also other charities and lots of community groups about what's been happening on the ground. And there has been an absolute eruption of people getting involved and doing all kinds of helpful things. So with the help of principally our volunteer centre members, but also other organisations as well, they have identified 6 kind of common coronavirus volunteer roles, and here they are. So you'll be familiar with these. I mean, you will have asked people to help out with these types of activities. You'll have been advertising roles and recruiting for these types of roles, shopping, medical supplies, deliveries, befriending, checking in, running errands, I don't know, like posting mail or picking up something from a sorting office, and paying bills, perhaps at a post office or online. So now, a chance for you to do, here's the brain, remember the brain in the top right corner, so it means your second poll is coming. I want you to answer 2 polls consecutively for me, please. do these volunteer roles require a DBS check? You only get a yes/no answer. There's no sitting on the fence. There's no not sure, don't know, ask me later. So please, I'll give you a minute or two to, while my colleague organises that poll for me. And don't forget, there are 2 polls. And while you're doing that, actually, I'd like to just tell you that based on the guidance which that we saw on Monday afternoon, just to remind you, it's perfectly fine for you to leave your home to help a vulnerable person from a different household to yours. It's fine for you to leave your home to donate blood or to tend to any medical needs. Any kind of charitable or voluntary work, it's fine for you to leave your home, whether that's coronavirus related work or not. There are some changes for those of you that saw the Prime Minister's speech on Sunday. There are some changes around the fines that the police can impose. So yeah, that has changed. I mean, the police don't necessarily impose fines first off anyway. They can do other things, like they can disperse 2 or more people. 2 or more people are not supposed to be together unless they're from the same household. In a public space, they can ask you to leave the area, or they can fine, and they can actually arrest as well, but that's the more extreme end. So just bear in mind, you might want to let your volunteers know that those fines have increased, I'm afraid. Okay, let's have a little look and see what we can see. Bear with me, there's a very tiny little box that I have to expand. And I don't understand why the box is so tiny. Right. Right, okay, let's see. Shopping, okay, 24% shopping, picking up medicine, 36%, driving, 43%. And then shopping, 24, yes, I've just said that. And then I believe there's another poll, which you're probably all busy looking at right now. Now, that's not telling me, and this is a design flaw, that's not telling me yes or no. So I don't know if my colleagues can let me know whether that's a yes or no, because the limitations of GoToWebinar mean that that's not telling me what you think. Oh, okay, if selected, yes. Okay, brilliant. Okay, so let's go back. Okay, all the results are in now. I think you can see them. I can only see them in this very tiny, tiny box. Okay, so 24% say yes, DBS check is needed for shopping. 36% say DBS check is needed for picking up medicine, 43% for driving. And then, where are the other ones? Okay, 38% say telephone befriending. A DBS is needed for telephone befriending. And then 21% say DBS check is needed for running an errand. 65% say for paying bills. Okay, all right. There's quite a mix there, and it's very, very interesting to see that from you. Thank you very much. We're going to skip along. It's incredible how time is just marching by. Right, so regulated activity. Right, so DBS checks, as we've said, can help us to assess a person's suitability for a role, and that's whether it's paid or voluntary. Regulated activity is explained in Safeguarding Vulnerable Groups Act 2006, which is particular legislation, and there are specific areas such as providing healthcare, providing personal care, providing social work to clients, assisting with general household matters, assisting with the conduct of someone's financial or personal affairs, as in financial affairs, and also conveying, which basically means driving. So some of you kind of, yeah, you're along the right lines with what you were saying when you were saying that some of these roles do require a DBS check. However, we have to caveat this because it does depend on the purpose of the role. So what is the purpose of the role? Do you have clarity over that? If the role is involved in regulated activities, so this is why I said earlier, drilling right down to what will that person actually be doing. Can you visualize what you'll be asking that person to do? And it depends very much on, is it with a certain group of people who may be regarded as vulnerable in relation to age, illness, or disability? Or is there a person that this volunteer will be helping who could be regarded as vulnerable in relation to age, illness, or disability? So for the purpose of coronavirus volunteering then, some activity like shopping is regulated for certain groups. So you are on the money with that, well done. However, self-isolating or shielding does not place somebody in these groups. Just because somebody is self-isolating, it doesn't mean that they are necessarily classed as a vulnerable. They could just be somebody who has coronavirus symptoms and they're just staying at home for the 14-day period. That doesn't mean that they've got an ongoing condition or illness or that their age means that they are classed as vulnerable in terms of that legislation. So even if a person becomes ill, the purpose of the role, now this is why you've got to be thinking about the purpose of your coronavirus volunteering roles. The purpose of that role doesn't change. So that means that the activity may not be regulated. It's all about who are the people that the volunteer is helping, who are those people and what are their needs. Let's go to the next one. So let's think about non-regulated activity. You almost need to have two halves of the same coin. So for non-regulated activity, DBS checks are not required. There's no legal requirement to do them. So don't worry about them. You're better off taking some of the safeguarding measures that I mentioned earlier, like being more thorough and rigorous in the recruitment, asking critical questions about people's motivations. Why do they want to volunteer? I should say as well that there's been a horrible increase in people taking advantage and carrying out scams, pretending to have cures for coronavirus and all kinds of fraudulent activity. People, behaving as though they want to help, but actually doing the opposite. So this is why we need you to be vigilant. And in the absence of a DBS check, we've almost got to be more vigilant because there are people out there who are going to be unscrupulous in their methods. So if a volunteer is going to be in close proximity with a personal level of responsibility and or physical contact with someone who needs help, with someone who is regarded as vulnerable in terms of age, illness or disability, then those types of roles will be regulated and a DBS check will be mandatory. There's been an increase in telephone befriending for older people who are isolated, and that's understandable. But interestingly, that role is not eligible for even a standard or enhanced check. We have actually contacted the DBS to ask them this because we received so many inquiries from organisations that wanted to run telephone befriending. You can apply for a basic check for that role, and a basic check will show you cautions and unspent convictions, but weigh up whether or not you want to put the time and the cost, the money into doing that. So my main message then is don't rely on DBS checks alone. Use other additional vetting measures to check a person's suitability for a role. Right, here is the brain again. That means it's time for our fourth poll. So you have a volunteer. And I'm going to ask you, does your volunteer need a DBS check to do any of these? They should all be appearing for you now. I'm going to read them out anyway, quickly. So does your volunteer need a DBS check to do any of these? 1, go food shopping for someone who is living with Parkinson's disease. Yes or no? 2, run online storytelling classes for Year 6 children. Yes or no? These are all yes or no. Drive their sister who has sciatica, I never know how to pronounce that, but I do know people who have it, to an optician's appointment, yes or no. Make up food parcels in a warehouse supervising 16 and 17-year-old volunteers. Use their friend's bank card with their permission to make a contactless payment because the friend is self-isolating. Renew their neighbour's television licence. So while I'm waiting for that to come in, I'm waiting for all your wonderful poll results. Bear with me for a second as I try to expand this other teeny tiny box. Not understanding why this box is so small. Right, okay, so 81% of you said, and I'm assuming again, like before, 81% means that yes, a DBS check is needed to go food shopping for someone living with Parkinson's disease. Well done, everybody. 62% said run online storytelling classes for years. Yes, you do. Yes, you do. 8% drive their sister to who has sciatica to an optician's appointment. You don't actually, because you don't need a DBS check if you are helping out a family member. You just don't. Can you imagine how many DBS checks the DBS would be running if we were all applying to help our family members? So yeah, there's a bit of freedom there. Okay, 92%. Oh, hang on, this is changing as I'm speaking. Blimey. It's quite impressive. Now that I've made the box bigger and I can actually read the results properly, I'm very happy. Right, okay, I'm gonna have to just, yeah, I think it's closed now. Poll closed, right. 89%. Supervised 16 and 17-year-old volunteers making food parcels. Actually, you don't need to do that. It's not regulated activity. And if a 16-year-old or a 17-year-old is old enough to work or volunteer, even though they're under the age of 18, because a person is regarded a child until their 18th birthday, 16 and 17-year-olds inhabit this very strange, mysterious, you know, they've got certain freedoms. They can do lots of things that people over the age of 18 can do. So you don't actually need a DBS check to do that if you're just making food parcels. 12%, use a self-isolating friend's bank card with permission. You don't know, because that is a private arrangement between people. Yeah, you don't. Even though those of you who are being cautious, you're right to be cautious because you're thinking about the financial transaction there, aren't you? Which is sensible, but they're friends. We're not going to question if somebody says, hey, have my bank card because I need you to do this on my behalf. 17% renew their neighbour's TV licence. Not necessarily, depends how it's done, because I could renew your TV licence. I could say, don't worry about it. I'm going to, you can pay me back later. So we're not even exchanging any money. You're not giving me any money. I'm just going to, you're just trusting me with your TV licence details, and you're letting me go away and renew that for you on your behalf until you can pay me back. Okay, lovely. Well done, everybody. That was really good. Right, now, well done. We've got through How are we doing for time? We're doing very well. We're doing very, very well. We've got through the first part of the webinar. I'm just trying to move to the next slide. Oops, I've gone backwards. Great. Okay, so I just want to say before we wrap up that safeguarding section, it's an offence to request a DBS check for a role when it isn't necessary. I know that sounds very draconian. I know that does sound draconian. However, it kind of shifts the onus onto the organisation to really think about whether a DBS check is appropriate. Is it really necessary? So that's why that's in place. It puts the organisation in the driving seat to make that decision. You can't carry out a DBS check without seeking permission from the person that you want to check. I don't know if you remember, anytime you filled in, for example, a job application form, they ask you about the Rehabilitation of Offenders Act 1974. So that's basically them asking you there and then. It's kind of implied there. And sometimes, of course, if you are, if you're recruiting volunteers, you can be more explicit. You can say, well, this role requires a DBS check. How would you feel about having one? Or in order to undertake this role, it's necessary to have a DBS check, which means that if we accept you, we will be carrying out a DBS check. So I haven't actually asked permission, have I? But I've kind of communicated my intention, and I've given the context why. I've explained the role requires it. So regulated activity then, it's an offence to knowingly recruit a barred, a prevented volunteer into a role classed as regulated activity. The organisation will be held accountable for that. So switch yourself on to that. And if somebody is barred, if they're not allowed to work with anyone in regulated activity or to volunteer with anyone in regulated activity, then it is an offence for them to undertake that role. They should not be doing it, which is why that question is so crucial. Just asking people, have you been barred? Have you been prevented from doing any work or volunteering with vulnerable adults or children? Right, okay, we're on to wellbeing now. So we've got our final poll. Everybody's been really good with the polls. Thank you for that. I was a bit worried that maybe I was giving you too many polls, but so this poll, what does well-being mean to you? Simple, there's only 3 responses. Don't worry, there isn't a right or wrong answer. We're quite a young country in terms of developing our understanding about this, about well-being. Let's have a look then. Right, lovely. Okay, well done, everybody. Everyone's done this. Are the responses still coming in? Yes, they are. They're still coming in. So I'm just going to give that another 10 seconds or so. Okay, right, let's call it a day then on that one. So 11% of you said having more than I need to live and having plenty of choices. And 86% of you having enough to get by and not having to worry or struggle. And then 4% of you, I've never really thought about this. Okay, well, thank you for doing that again. It's a nice little lead in. It's just nice to sort of get a temperature check on what people think about it. So there is actually a definition of well-being in the English Oxford Dictionary, and it is the state of being comfortable, healthy, or happy. I guess some of the things that spring to mind that contribute to being comfortable, healthy, or happy would be things like having enough food, having regular, secure work, being able to volunteer as and when you wish, not feeling pressurized to volunteer, access to healthcare, time out in nature, physical exercise, taking care of our mental health, getting enough sleep and resting. Some would say being rather than doing. So all of that is valid and all of that is useful. So just thinking about your volunteers then, what can you do to support volunteer well-being? So here are some tips. Check in with your volunteers regularly. It could just be a little phone call. It could even be a text. Check in with them, see how they're doing, see if they feel well enough. People should only volunteer if they're feeling well enough. It is quite an overwhelming, bewildering time at the moment for pretty much everyone. So the act of asking and listening will open up a space for you to see how your volunteers really are. Hand washing. You know all of this. You know the hand washing mantra for at least 20 seconds. Reminding your volunteers to try to keep physical distance wherever they can. I've said earlier, avoid going to people's homes. Telling volunteers to let their family and friends know how they're doing and what they're doing as well. Don't be afraid to ask for help from statutory services. You should remind your volunteers about that. You know, if there's anything concerning them, they can come and talk to you. If they've been helping somebody out and they're feeling that actually there's another issue there. Remember that statutory services may be better placed to provide help if a situation suddenly changes. None of this is a power struggle. It's about getting the best help to the people who need it, you know, when they need it, not after the fact. Encouraging volunteers as well, not to take on too much or overcommit, because it can lead to them feeling low and feeling disappointed, and also the people that they're helping may also feel that disappointment too. So, right, we also know that we spoke to lots of organisations and we said, well, what are you doing in terms of helping your volunteers when they're out and about? What if they do get stopped by the police? And how are you approaching that situation? And they told us that some of them are issuing their volunteers with ID cards with the volunteer's name or their organisation and the organisation's contact details, or perhaps they're providing the volunteer with an official letter from the organisation, or they're sending them a text when they're out and about to say, this person is volunteering for this organisation and this is what they're doing today. So just so that the volunteer has some confidence when they're moving around, that if they do get stopped by the police, they've got something to show the police that they're out for a legitimate reason. Right, so, and then coronavirus testing. So tests are available for all essential workers, including volunteers in NHS and social care work. Anyone with symptoms, anyone aged over 65 with symptoms, and also anyone with symptoms whose work cannot be done from home. If you have symptoms of coronavirus and lives with any of those people, they are also eligible for a test as well. This applies to volunteers and paid workers, and the test is most effective within 3 days of symptoms developing. There are some links embedded in there if you want to find out more detail about how to get a test. You can apply for a test directly if you're in any one of those groups there, or you can select a regional test site or a drive-through appointment, and you can get tested there. I believe there's also home testing kits as well. So a little word then on personal protective equipment. So clearly there has been, and there continues to be, a shortage of PPE, including face masks. Volunteers carrying out roles such as the ones we've looked at today on this webinar don't require PPE. Volunteers in riskier environments such as hospitals, clinical settings, care homes, or looking after someone who is shielding or clinically vulnerable should follow the advice of the organisation and maintain hand hygiene at all times. Gloves, I'm afraid, are a false security and they simply lead to cross-contamination. People think that if they're covering their hands, they're somehow completely protected. And I think that's also been the debate around masks, that it kind of induces this kind of false sense of security. It's better to wash your hands thoroughly and often, disinfect frequently, touch surfaces, furniture and other high traffic areas. So the jury is still out on how effective face masks are in preventing transmission. We're not going to conclude anything today, I'm afraid, on that one. It's a bit of a moving target, isn't it? It's an ongoing debate raging in different countries as well. You can see some countries have actually made it mandatory for people not to leave the home without a mask. You can make your own fabric face mask, and the government have actually suggested how. And on that link embedded there, you can find out how to do that. Just remind volunteers not to touch their face if they're wearing a mask, and just not to be too emboldened by wearing one. It's not going to give you, it's not somehow going to be this magic thing that will protect you. Physical distancing at all times should be maintained. So, supporting volunteers. This is a wonderful partnership. Our Frontline is a wonderful partnership between Shout, Samaritans, Mind, Hospice UK, and the Royal Foundation of the Duke and Duchess of Cambridge. So volunteers in healthcare, social care, or emergency services can access telephone support as well as top tips on coping with coronavirus volunteering. There's a lot of resources on this website. It's very, very impressive. I had a look and I thought it's definitely worth including for you. Now, the other thing I want to tell you, which is very impressive as well, is REDAR are running free training. Now, REDAR are London-based international development organisation, and they train emergency and relief workers who are going overseas. Now, they're running this free training on coronavirus. They very rarely run training for people working in the UK. All their work is focused overseas. However, because of the pandemic here, they have put on these 3 courses, and they are completely free. You don't have to take these modules in any particular order. It doesn't matter if you want to do, you know, myth busting first, and then managing stress, and then culturally appropriate hygiene promotion. If you can also take just 1 course. You don't have to take all 3. They're completely standalone. They will make sense if you only want to do 1, or if you want to let your volunteers know and perhaps they would like to jump on one. They use Zoom and there are about 15 to 20 people on them, so they're quite interactive. I took all 3 modules and the managing stress one is obviously particularly relevant because we're talking about well-being. We spent over an hour discussing you know, what causes stress and understanding what are the physiological factors in that. And then we talked about how it affects the brain, and then we looked at what we can do practically to manage our own stress and the stress of others as well. So it's not like an academic course, it's really practical, but it gives you a bit of a foundation in terms of what actually happens to you physically when you're stressed. So do jump in and get them, because those are the dates, and they've already been running them for the last 6 weeks. So this might be the last opportunity to jump on, or to tell your volunteers to jump on really quickly. The other thing that is completely useful and also a lot of fun, Support Cambridgeshire have produced a great little video for volunteers, and so have, and that's all about staying safe, Support Cambridgeshire. It's only about 1 minute and 51 seconds. And then the British Red Cross have also produced a training video, and there are lots of topics on that. It's a bit more involved. There's a quiz to test people's learning. And again, it's a really handy resource to give your volunteers. So both of the links are embedded there. You just to make everything easy for you, to save you as much time as possible. Right, now we've got to the point where questions. How are we doing for time? Aha, we have got time. So while you're typing away your questions, I've got a couple of questions here which are relevant because they came up in a webinar that was delivered last week by Sean Delaney from the volunteering team, who is my boss. And I'm just going to, while you're typing away, and as I said, don't worry if you don't get all your questions here right now, you can send them in, and there's an email address at the end as well on the slides. And as I said to you before, we'll find the answer for you and we will come back to you. We won't leave you high and dry. So I've got a question here. Are there any rules or advice around sharing phone numbers, if setting up, for example, if setting up a WhatsApp group? So my response to that is COVID Mutual Aid, as in the UK COVID Mutual Aid, have guidance on setting up WhatsApp groups. But it's more the nuts and bolts. It's on their website. It's more the nuts and bolts of setting one up. So in terms of rules, they tend to have an administrator on their WhatsApp group, and that person oversees the whole group. And they work to guidelines about, not selling and not posting anything offensive or discriminatory. It's the same with their Facebook groups, which are moderated very well. I'm on 2 COVID Mutual Aid local groups. They're very different in character, but they're brilliant. So people really, it might be worth contacting COVID Mutual Aid because they must have done something magic behind the scenes with their local groups. That they haven't put on their website, because the ones that I'm on, I think are quite well maintained. Okay, with regard to DBS checks, what if you have volunteers supporting a mixed group of people, including vulnerable people? Okay, so write down who are the people being helped and in what way are they vulnerable, in what way do you know of this, what do they need help with, and what exactly would the volunteer be doing for them? And that will tell you whether you need to carry out a DBS check. Generally, if roles involve driving, caring, personal care or intimate care, or assisting with financial matters, including shopping for somebody who's vulnerable due to age, illness or disability, then those will require a DBS check. I have one here. If you are volunteer shopping for someone who is shielded and vulnerable, do you have to have a DBS check if you don't have contact with the person and if you don't exchange money? So I just want to try to make this distinction with you. So there's a difference between someone who's shielding or self-isolating because they're in a high-risk group that makes them vulnerable to coronavirus, compared to someone who may not be on the government website list of extremely clinically vulnerable, who has a disability or a life-limiting condition, but is not predisposed to coronavirus. So remember earlier on, we looked at some of those examples. So it's a good idea to ask yourself this question: would supporting this person in this coronavirus volunteer role, would they have been classed as somebody in regulated activity before coronavirus came along? And if the answer is no, then it's not likely that they are in regulated activity. If the answer is yes, then it means a DBS check is required. Let's have a look at more questions here. Again, I've got this crazy box. Just bear with me for a second. Right. Okay, somebody said, when you say this role would need a DBS check, what level of DBS check do you mean? There are different levels. I'm sorry if I haven't gone into it in the detail that you need. We have got this information on our website, and it's about the organisation also thinking about what is that person going to be doing. So it's an abstract question to ask what level of check is needed. There are some good examples. If I can signpost you actually, and we are going to be doing this on the NCVO Know-How website, we're going to be linking up more with some of the great resources that are out there so that you can jump on the NCVO website and you can just be signposted off to exactly what you need. I've looked at a lot of really good resources that some of the volunteer centres have produced. Volunteer Centre Tower Hamlets have got a really good list on their website, which we checked off with the DBS as well, around what kinds of roles need checking. Okay, if volunteers are reluctant to return to, hang on, that one jumped away because another question came up. If some volunteers are reluctant to return to volunteering, is there a timescale for return to work in the office environment? I'm not quite sure I understand that question. I'm not quite sure I understand it. So I will contact the person who sent me that and ask for some clarification on what is being asked there. Somebody has said, please do remember the boundaries of the role as a volunteer to report to the appropriate person in the organisation, and that local councils have their own safeguarding boards who can also provide support. Thank you very much for raising that. Thank you. Very much appreciate that from you. I understand that telephone befriending does not require DBS checks. If this is true, if you are befriending someone in a vulnerable group, e.g. a person with dementia, and the rest of the question hasn't quite ended there. I'm not quite sure what's being asked there. Is this still true if you are befriending someone in a vulnerable group? If you're befriending somebody in a vulnerable group, then you will need a DBS check. The problem with telephone befriending is the DBS is sort of fallen through the gap a bit. I know that sounds very strange, but we did ask the DBS about, you know, what should we do about telephone befrienders? And they said, well, they don't actually ask for, they say it doesn't sort of, only a basic check can be done. If a person is vulnerable, I mean, I would have said that, you know, somebody with dementia, that an enhanced check would be required. There may be another way to get around that. I think I'll come back to that because we never seem to stop getting questions about befriending. So, okay, age and safeguarding. I know that age will mean under 18, but does it mean over a certain age? No, it means you are a child until you hit 18. But as I said, 16 and 17-year-olds, they kind of inhabit another world with all of this. They can do a lot of things independently, and you wouldn't treat them as you would a 13 or 14-year-old. So again, think about what it is they're being asked to do and who they're being asked to do that with. That's interesting. Phone befriending, a DBS equivalent is required in Scotland. Okay, right. There's lots of questions here. Don't worry. I've got your names, and I believe that your emails will be on here too. So I will come back to you. These webinars always generate more questions than we have time for. But as I've said, we won't leave you high and dry. It might take a little bit of time for us to come back to you, but we will come back to you. Somebody in our team will do that. So just to kind of wrap up then, and thank you for staying with us on this webinar. So this is what's available. This is the latest guidance on the NCVO Know-How website. There's a big section on coronavirus, and volunteering is one part, just this section. There's a bigger section on coronavirus. So have a good look there and see what's helpful to you. We will also be updating this guidance, and we're very good at keeping on our toes about that as the government is issuing more guidance as we go along. And there's also some interesting blogs that you might want to read. These are our latest volunteering blogs, and you might want to you know, spend some time reading about what we're saying to government, what government is saying, how you know, what we think about that. We also have a monthly volunteering roundup you can sign up to, which has links to all the latest volunteering news. So you can just get one email rather than trawling websites looking for reading lots of different blogs. So stay up to date. You know, I will take care of your questions. Don't worry, I will come back to you. If you don't follow us already, please follow us on Twitter. We have a very big Twitter presence, and there's lots of information on Twitter that's quite useful that you can use. Please remember to complete the short evaluation on SurveyMonkey to tell us what you think when you leave the webinar. And as Claire said at the beginning, a recording of this webinar will be available on the NCVO website for you to download and share. I hope you found today useful, and thank you very much for coming.